Hello, my name is Rhonda Mopolini, and I am the Executive Director of the University Center of the Mountains. We are a higher education center or transfer center. And today I'm meeting with one of my UK partner representatives, Julia Berry. She's the Educational Didactic and Admissions Coordinator for the College of Health Sciences, which is also part of the Department of Physician Assistant Studies. She's a University of Kentucky employee. And I've asked her to join me today to talk to you a little bit about the Physician Assistant Graduate Program. This is a fabulous program. That profession is being ranked nationally as one of those best career choices to go into in terms of the healthcare area. I have a daughter who's looking at that particular program. And through the University Center of the Mountains and my KCTCS partners, the UCM, by the way, specifically located on the Hazard Community Technical College campus. We serve students across a wide region in Eastern Kentucky. So any of our students who are thinking about going to college and they may want to use the community college as a stepping stone, doing their freshman, sophomore coursework at Hazard Community and Technical College or any of the other KCTCS institutions in the region, feel free to contact us, because what we very much do is work with our KCTCS students who need to select the correct freshman, sophomore classes, because they will be what are called transfer students. So if this is, you and your situation, you would want to plan on transferring to a four-year college or university to get your bachelor's degree. And while you're doing that, you want to make sure you're taking those prerequisite courses that are appropriate or required for admission into the physician assistant program. And so the UCM works with Julia. We work with our different partners and advisors, and we can provide that very concrete guidance and make sure we keep you on a smooth, direct pathway so you can go through those 4 years of college and apply and go into your graduate program. So with that quick introduction, and I'll remind you at the end, give you my phone number, UCM information. But with that being said, let me go ahead and I'm going to turn it over to Julia Berry and let her tell you all about what a physician assistant is. And it's all yours, Julia. Go ahead and share your screen. And
thank you, Dr. Mobolini, and I'll start sharing right now. And as she said, we really do have a great partnership with UCM. We've had some great students coming from that campus into our program, and it is a great pathway, especially if you want to stay close to home. And we can even keep you close through the PA program, and I'll touch on that here in a moment. But yes, I am Julia Berry. I oversee admissions for the University of Kentucky Physician Assistant Program. It is a graduate program. So I'm going to do an overview of what a PA is, since many of you may be high school students or incoming freshman or sophomore and really not sure what a PA is. I'm going to touch on that. I'm going to touch on what our program is, a little bit about our certificates and curriculum, and just a little bit about the criteria, the admissions criteria for the program. So a lot of times people don't truly understand what a PA is and what they do. They hear the word assistant and they think that maybe a physician is standing over them, telling them how to do things, or, just giving them tasks to do. And that's really not how they work. They work more collaboratively with the physician under their supervision. So they can take the medical history of a patient. They can perform the physical exam of a patient, order lab tests, diagnose illnesses, treat illnesses, counsel patients, promote wellness, and assist in surgery. So, for example, you may go to the ER or you may go to a clinic somewhere and you see someone in a white coat and a stethoscope, and you would assume they're a physician. But pay attention to the initials beside their name. They may be a PA, they may be a nurse practitioner, because if I went in the ER and I had some breathing issues, I wasn't feeling well, they would come in, they would take the medical history of me, they would perform a physical exam, so they may use their stethoscope to listen to my lungs, they may look into my ear, nose, throat, they would order lab tests, so they may need to get x-rays or blood work done on me. Once they get back the lab tests and they're finished performing that physical exam, they could diagnose my illness, so maybe I had pneumonia. And then they can treat it. So they can prescribe antibiotics or any type of other prescriptions that may be needed. And of course, counsel me, promote wellness. In assisting in surgery, it really depends. If I came into the ER and had a really bad laceration, they could sew me up right there. But if it's more of an extensive surgery like cardiothoracic surgery, PAs may be the first or second assist in that surgery, depending on the relationship they have with their supervising surgeon. Most programs are usually 26 to 29 months long, and they are either graduate or professional programs, so you would have to have your undergraduate degree. And you have didactic courses, so that's your sitting in the classroom, taking labs, things like that, preparing for learning how to treat patients. And then they do at least 2,000 clinical rotation hours. So you hear maybe about PA or physicians or nurses doing rotations. PAs do the same thing. They go out every 4 weeks. They do a clinical rotation where they're doing hands-on learning, and then they come back, take an exam on it, and then go back on another rotation. They must be certified, so they have to graduate from an accredited program, pass the boards called the PANTS, and also become licensed in the state they want to work. So if you wanted to stay in Kentucky, you would become licensed in Kentucky, but sometimes PAs live on the border of Kentucky and West Virginia or Kentucky and Ohio, and they can become certified in multiple states if they'd like and work in both states or as many states as they would want. They must recertify every 10 years. So just like any health profession, you're going to have to keep up on your education. So they do take their boards again every 10 years, and they have continuing medical education that they must complete every 2 years. And a lot of times those are provided through your clinics or hospitals that you end up working at where you're getting CME hours. This is the average compensation that we're seeing for physician's assistants now. There's around 100, it's around 112,000. Kentucky looks a little bit in the lower end there, but I've rarely heard of any PAs making less than 6 figures in the state. It just really depends on where you want to practice, and if you're going to work in primary care compared to surgery. You're obviously going to make more money if you work in surgery than just primary care, but they do make good money, and they get out of school a lot quicker than med school, so they don't have as much student loan debt. It is the #1 best overall job now. It used to be #3. We have bumped up to the best overall job as well as the #1 best healthcare job. It is the fastest growing profession in the country. We've seen it grow over 300%, and we expect it to grow another 31% in the next few years. So it is a great profession to get into. You're going to always have a job if you work in healthcare. And again, the money is really good for coming out of a graduate program in 2.5 years. So this is the mission for our program. UK is very keen on wanting to find students that are interested in staying in the state and helping improve the health of the state. So we want to improve the health and well-being of the people of the Commonwealth by graduating competent and compassionate PAs. And we want them to go back and be transformative leaders in their practice and communities. So we really do want to see students that want to go and give back to the state of Kentucky. We are the oldest program in the state and one of the oldest in the nation. And we do have 2 campuses. So I mentioned earlier, you could stay a little bit closer to home. We have a Moorhead campus. That's our rural campus. We take about 16 students there, and it's a great campus. They feel like a family there. We have 2 faculty members there. We have a program assistant. I travel up there at least once a week, and they really become close with one another. They have a really great facility there, and we also have a share building, the Center of Health Education Research in Moorhead. So they have their own gross anatomy lab. They have their own classroom, and the professors will teach across ITV, but there are professors that may be teaching from Moorhead to Lexington. And any type of hands-on lab, like your gross anatomy lab or your patient care lab, there is a faculty member there in person teaching. We're also one of the very few programs in the nation that have sent students overseas or internationally for clinical rotations. Not many programs have those types of partnerships. So we have students who have gone to Kenya. We have a former professor that goes there and does a lot of eye surgeries. We have a former Moorhead campus student who started her own inpatient, outpatient orphanage there. So she takes students there in her clinic. We have a collaboration in England with one of our former professors over there as well, and he visits us at least once a semester. And then we have students who've gone to Swaziland, which is also a very unique experience where they're doing a lot of women's health, they're delivering babies, and they're literally out, you know, in the bush, and they're walking around with tigers, or not tigers, but lions and elephants, and it's really interesting to see their experiences at these international networks. We take around 56 students. So if you're interested in Lexington campus, we do take 40 students there. And again, we have 16 students in Moorhead. Faculty expertise. So we have a very diverse faculty that have worked in many areas clinically. So most of our faculty are either PAs or physicians. So they have worked in areas like cardiology, women's health, sports medicine. We have folks from the anatomy department teaching, physiology department teaching. We have 2 courses in pharmacology. So the dean of the College of Pharmacy also teaches our pharm courses for the program. Certificates. I'll touch on this a little bit, but there are additional certificates that you can do while you're getting your master's at UK. A lot of students choose the gerontology or global health certificates because they have some courses that cross-reference with our courses, but there will be additional courses in the College of Public Health that you would have to take to get these certificates, and we could always talk about that more whenever you get into the program. Our program starts in January. Some programs start in the fall, but some programs start in January. So we are a little bit different, and we are a little bit of a longer curriculum. We're 29 months, so you have the 17 months of didactic and then a full year of clinical rotations in the program. So when you go on rotations, we put you somewhere in the state. We try to keep you close to home, but you may be in Western Kentucky for a rotation, and that's fine. We'll help you find somebody to live with, or some students do have family in different areas that they can stay with to do their clinical rotations. Clinical rotations are every 4 weeks. So family medicine and internal medicine are actually 8 weeks long. They have 2 different 4-week rotations in those, but all the rest are every 4 weeks. So the students will go out to a family medicine clinic for 4 weeks, and then at the end of that 4 weeks, they come back to Lexington. All students, Lexington and Moorhead, come back to Lexington, and they take an end of clerkship exam, and then they prepare to go out for the next 4 weeks. So they may do a rotation the next time in pediatrics. Now you'll see at the bottom there are 3 electives in medicine. So electives are your chance to choose a specialty if you would like. So some students are interested in dermatology. It could be cardiothoracic surgery. It could be sports medicine, really any area of medicine that you're interested in. We can put you in one of those for an elective. Sometimes an elective may be if you go on an international rotation, if you end up going to Swaziland or Kenya. Sometimes we have students that need to do an extra rotation in, let's say, pediatrics because they may have struggled a little bit on that exam. We want to make sure that they're prepared to take their board, so we may put them in another rotation. And then another option for an elective is maybe you really loved your emergency medicine rotation. You know that they're going to be hiring there, so you want to go back and kind of give them another 4 weeks to get to know you and maybe want to hire you once you get out of the program. And again, these are all throughout the state of Kentucky, but we do try to keep you a little close to home if we can. So we also have post-residency programs. This is something new that we just started. So when you go to PA school, that's a graduate program. You have all those different areas of medicine you learn, because when you graduate as a PA, you should be able to go work in any area of medicine. And that's why a lot of people choose the profession over being a physician, because physicians have to do a residency program, specialize, and then they work in that the rest of their life. PAs don't have to do that. But there are options for PAs to do a residency program. If you really, really are interested in something and you really want to specialize in it, there is probably a residency in it for PAs. So for example, in our program, we also have residencies in critical care, acute care, surgery Baptist in Lexington, as well as hospital medicine. If you do one of these residencies, it doesn't mean that you have to work in surgery or work in acute care the rest of your life as a PA. You can always change and do something else, but there's an option to be specialized if you really, really want to do that. Whoops, I skipped over one. Let me go back. So, other resources we provide for our students, of course, the Student Health Services. And if you're at the Moorhead campus, you're a UK student, but you also get a Moorhead State ID, so you can still use their workout facility, their health clinic services. We also provide really good academic support to our students, so they have one-on-one faculty advising. They have access to the study, which is a really great coaching that gives you help with studying and test-taking skills, note-taking skills, and then we also provide peer tutoring for anatomy and physiology. And I believe I skipped one more slide. Yep, tuition. This is a big one I wanted to touch on because tuition, I know, is overwhelming, especially when you're an undergrad or you're a freshman coming in and you're trying to figure out all these loans. But to put it in perspective for PA school, so you would do your undergrad 4 years, and then you have 2.5 years of grad school for PA school. A full 2.5 years in PA school total tuition is $60,000. Now, I know that sounds like a lot. However, if you wanted to go to med school, 1 year in med school is 6 figures. Okay, so each year, your 4 years in med school, you're racking up, $400,000 worth of debt. When if you go to PA school, you're done in 2.5 years, you only rack up about $60,000 in tuition debt, and then you can start working, making a 6-figure salary. So that's another reason a lot of people become interested in the profession and the program, because it is a little bit cheaper route, and you get to still work with patients just like a physician. So I'm going to touch on some things about applying, but if you're a freshman or sophomore or a high school student, it's going to be a little few years before you can apply. So some of these things may change, but just to kind of give you an idea, we do a holistic admissions process. So we don't just focus on your metrics such as your GPA, GRE scores, and things like that. We like to see that you have volunteer experience, you have leadership experience, and patient care experience. I'm going to skip through these real quick and go over just the basics. So you do need a bachelor's degree, as I mentioned before, and these are the average GPAs we're seeing for students that get into our program. So they are very strong students. They're usually coming from a science curriculum. And as I mentioned, UCM and the KCTCS programs really prepare the students. They have all the courses you need through KCTCS to come into our program. Also, the degree really doesn't matter. You can have a degree in biology, but we've seen students come in from marketing, business degrees. We've seen Latin American studies. We've seen former teachers come in. So your degree can really be in anything. As long as you complete these specific courses, and again, these are all offered through KCTCS. You wouldn't have to go anywhere else to get these courses. So you have your basic sciences like the chemistries, the biologies, the anatomy and phys, but you also have some non-science courses like psychology, sociology, med-term, and statistics. We do require that you get a C grade or better in all these courses, and you can do up to 1 retake per course. So if you end up getting a D, your chemistry 1 because you're a freshman and you didn't have a strong chemistry background, that's okay. You can retake it as long as you get a C or better. Withdrawals don't count as a retake. So if you get into a course and you feel like you're really struggling and it's, the withdrawal period hasn't come up yet, go ahead and withdraw from that course, regroup yourself and prepare for it and do better the next time. And then students can also apply with 2 of these outstanding. But again, when it gets closer to you applying, we would go over those things a little bit more. We do require the GRE. This is kind of like the ACT that you took in high school. This is like the graduate side of things, but we don't set a minimum. We don't put a lot of preference on it because we haven't found any data that states that this prepares you for PA programs. But if you did have a lower GPA, we would kind of focus on the GRE just to make sure there aren't any academic issues. So you need to take it within 5 years. We super score, so you can take it as many times as you want. And that means we'll take your highest verbal, your highest quantitative, and your highest analytical scores. Another big requirement for our program is patient care experience. So it's really good to start early, not waiting until your junior or senior year of college, because then you have a lot of hard courses you're trying to take, in addition to trying to apply. So start looking for jobs as a CNA, an EMT. We've seen med techs, phlebotomists. We also have students who are scribes, and even though that's not really hands-on direct patient care, that is one of the experiences we will count. But we like students to have some hands-on patient care experience, like taking vitals, blood pressures, glucoses, things like that, because you're taking 4 years of med school and squeezing it into 2.5 years to be a PA. So we need you to have those skills kind of ready. We also highly recommend shadowing. A lot of folks don't realize what a PA is and how they work. And I've had students who are seniors and they come see me and say, I was pre-med all 4 years and I thought this is what I wanted to do. And then I shadowed because I needed it for med school. And I realized the PAs were the ones actually working with the patients more than the physician. And then they had to change. And then they were missing things like direct patient care or some of our courses. So definitely start shadowing so you can get an idea if this is the profession for you. And try to find someone in primary care and then also branch out to the different areas of medicine so you have an idea of the diversity of the profession.
And Julia, These are things that students could do while they're in college working on their bachelor's, correct?
Yes. So a job
how do
that
you recommend, yeah, exactly. How do you recommend that they document that time?
Oh, that's a really good question. We just have you, when you complete the CASPA application, there's a section there that they put in all their hours. So I just suggest to students, you may want to keep your own spreadsheet so you can, put those hours in, but we don't have anything that's required to be signed or anything like that, because in CASPA, you put in their name and their contact who supervised you, and then how many hours you're working a week and how many weeks you've worked, and then it just averages it for us. But it is a good idea to kind of keep your own little spreadsheet so you're not trying to remember all you've done for 4 years before you apply.
Well, and then also, I guess when they're having recommendation letters drafted, often that person with whom you've worked, keep in mind that's someone that you may want to ask to write a rec letter for you, and that serves as further documentation of what you have done and so on.
Exactly.
Okay, thank you.
Yeah, exactly. As I mentioned, because we do holistic admissions, we do like to see leadership experience, and this is kind of the piece that's really setting people apart. A lot of our applicants are so competitive academically with patient care and shadowing. What's really making them stand out to get their foot in the door for an interview is the leadership experience. And it doesn't necessarily have to just be leadership in a campus organization. You may be a manager at the place you work. You may be a college ambassador. You may be a college athlete. We will accept those things as leadership. We even have non-traditional students who apply who are parents, and they may be a coach for their kids' soccer team. That's considered leadership for us. Also, volunteer experience is really important, and it doesn't have to be medically related. It actually is nice to kind of see something different. So we have students who have more direct experience, like big brothers and sisters, or maybe they work with a certain school and they're going there and tutoring the students, or Habitat for Humanity. And then they'll have some indirect experience sometimes if they're a part of some campus club or organization where they do some philanthropy work there. It's rare, but we do have applicants that have some research experience in teaching. But if you don't have those things, it does not hurt you. The big two I would say on this slide would be the leadership and volunteer. And the same thing with recording or documenting your patient care and shadowing. You want to kind of keep up with these hours because the application is going to ask you, about your experience, how many hours you did, explain what your role was. So it's kind of like you can keep a little journal about yourself throughout college. This gives you an idea of the demographics for our class. We do have more females than males. We've gone up a little bit in our males, so that's good. Out of state, we saw a big jump in out of state students. We're usually around 20 to 23% out of state. Even one year, I think we only had 10%. But we did have about 31% out of state this year. Non-traditional, again, we get a lot of older students, and it's just because maybe they're changing professions. So we do see around 31% non-traditional, and our diversity has gone up. We do have a lot of diverse students now, around 22% that we're really happy with. Other things that you'll need to keep in mind when you're applying, there will be essays. So CASPA is that centralized application for PA programs. So it's going to ask you, why are you interested in being a PA? And so that's where shadowing is a good thing because you kind of learn about it, learn why you're a good fit for PA. And then we have additional questions that we ask. So we've added questions, you can only choose one campus, either Lexington or Moorhead. So we ask you, why did you choose that campus? We also ask a question about working with underserved groups or populations, as well as a question specifically about our mission. And remember, our mission is to improve the health and well-being of the people of the Commonwealth of Kentucky. So we want to know, how do you fit that mission? What are your plans in fitting that mission later on? And as Dr. Mobilini mentioned, we do have letters of recommendation that need to be submitted electronically, and we require 3 specifically. So we do want to see one from a physician or PA, preferably someone you've worked with or shadowed, an academic professor or advisor, or it could be a committee letter, and it would be preferable to have someone that has taught you in one of those science courses. And then your third one can be anyone medical or academic. So you may have worked as a dental hygienist for your patient care, and you want your dentist that supervised you to write that medical reference. That's completely fine. And then CASPA does allow up to 5 evaluations. It's not required to do those 2 extra. In some cases, it has hurt people because they're not strong evaluations. So as long as you get those 3 and they're really, really strong, that's what we need. And if you're able to get 2 more that are really, really strong as well, that's great as well. I'm not going to touch on this really too much on how to apply. There are going to be 2 applications, but this may change by the time it comes around. But our application always opens in April and it always closes in July. And then we do interviews usually in August, and then you start the program in January. If you have any questions, you can always check our website. The good thing is, to prepare early, think about getting that patient care, the shadowing, the leadership, and also think about prepping for interview because it's very, very competitive after you go through your interview as well. And if you have any questions, you can always contact me. My email is on this slide here. And if you're not able to get a hold of me, you can also contact Dr. Casey Shaddix, who oversees advising just for the entire College of Health Sciences. And we're happy to talk to you guys if you're interested in visiting, especially the Moorhead campus. I have keys to everything there. It's a little bit harder to get into places in Lexington, but I can show you guys around Moorhead, or get you in touch with one of our students if you want to talk to them as well.
Thank you, Julia. Excellent. Leave that up for just a few minutes, and just kind of wrap us up. Let me comment on. And I was taking notes as you were talking and jotting down some questions to ask, but then in the process, you answered all of those. These are just common questions I get when I'm advising or out speaking to students about this program and our partners and so on. So thank you so much. One thing I'll comment on, and Julia, it's kind of a nice way to segue into this. She'd mentioned the interviews, and interviewing is a common admissions process for several of our 4-year partners graduate programs. So the UCM started a few years ago offering mock interviews and providing some basic interview skill resources and things of that sort. So we're certainly doing that again this spring on April 7th and the 8th. But again, someone may be viewing this after that date. Just know that typically every spring semester, usually in early April, because that seems to work best, the UCM will set up a series of mock interviews. And what we do is I recruit volunteers from all of our different partners. Julia is one of our volunteers. I'll have others from maybe Sullivan College of Pharmacy and from Moorhead and EKU and Hazard, and sometimes a college president will offer an hour or two to do some interviews with us, and somebody from HR, Human Resources. They often do the job interviews, and we'll put together a mock or pretend, I'll put together several mock or pretend committees, and then we'll set up and schedule. Right now we're doing them all kind of like the way you're probably viewing this, using Microsoft Teams, doing the virtual piece. When we get back to in-seat, hopefully, by next spring, we often host these in the UCM and do actual face-to-face mock interviews, but allow students to practice that because a lot of our students have never had that experience. And it can be a little nerve-wracking. So it's very, very helpful. We've received excellent feedback. So it's very, very helpful for students to come in, practice that, because sometimes you'll be asked a question that just sort of throws you, not that you don't actually have a very perfect a good answer, but sometimes it just escapes you for that moment. And practice, just like anything, preparing will make you feel more comfortable, will allow you to then do a better job. And again, in terms of our Eastern Kentucky students that we serve, the UCM's trying to do any and everything we can to support you in going forward with your education. That's part of our mission, to help you to get into programs and things of this sort. And then I'll also mention a few years ago, Julia had invited me to come in to be on one of their interview committees for students applying to this program. And that was a wonderful experience for me because they had a whole group of docs and PAs, all these professionals from the area who were meeting and looking at student applications. And then we were interviewing the PA applicants, and I went to the Moorhead campus that time. So it was my first time seeing the facility, which is a fabulous facility. Julia mentioned that one of the UK programs at the Moorhead campus for the rural area. Beautiful, beautiful facility. And then the holistic interview process. I was so very, very impressed with that process. And we've actually borrowed some of the concepts and ideas from my experience getting ready to see how that's done to set up our mock interviews and work with students. And I'm seeing more and more programs, graduate programs, that are taking more of that holistic approach and looking at that whole student, not just that person who's studious and has straight A's, but that person who's a well-rounded human being, because they're, research, they're finding that those folks often make overall better healthcare providers. Because they are able to communicate and relate to patients. I mean, that's a large part of that. That patient has to trust you and be willing to listen to and hear what you have to say. So, those soft skills we talk about, they're so very, very important to all of that. So I really enjoy getting to do all of that. And let me mention, as kind of to wrap us up, if you are interested in, or you want to get on our list because you would like to participate at some point in the mock interviews, and it's not just for the PA program. We have students who are applying to med school and pharmacy. Sometimes it's just a general job application and they've never had that opportunity, and they just want to come in and practice a mock interview. We can gear the mock committee according to whatever your particular need is. But contact us in the University Center of the Mountains and let us know you would like to be added to that list. So when we get our dates set and our committee together in the spring, we'll be sure to contact you and let you know about that. The number at the front desk for the University Center of the Mountains is 606-487-3252. And then the direct line into my office is 606-487-3252. And I do have voicemail. So if I'm in class or not handy, just be prepared to leave me a message and your contact information, and I can follow up with you. And that wraps us up. Julia, anything else you want to add? Anything you think we forgot to highlight?
No, I really do strongly encourage students to take advantage of the mock interviewing. We don't really have a lot of folks that get that type of resource. And I know you may think, even if you've done a million interviews in your life, it really is different when you're interviewing for professional programs or grad programs. I mean, I know some of the questions that we ask, and we update ours. We critically assess our interview questions every year and update them. And there are questions I think, oh my gosh, if I got hit with that question and wasn't mentally prepared, I would have a difficult time answering that. So a lot of practice is really, really good. So definitely take advantage of that. And I can't, say enough how much I love UCM and what you guys do down there for your students. You don't see that a lot at other schools, and the students really need to take advantage of your all's resources.
Well, thank you. And the only reason we're able to do what we can do is because of great partners.
Yeah.
Like UK and our Center for Excellence and so on. Exactly. Yeah, because it takes a team effort. I have, well, we'll talk a little bit more about that later, but I've got a great group of volunteers already for the mock interviews this spring, and I was just so pleased with the number of responses I got right away.
It's going to be good.
I'm looking forward to that. And this will be a little new, the way we're doing it with the Microsoft Teams and so on. So anyway, but again, contact me if you need to get a hold of Julia, or you've got her information. If you jotted that down, and just remember, high school student, college student, University Center of the Mountains, we'll get you connected to folks like Julia or whomever it is you need to speak to look forward to your graduate program and to talk with you about what kinds of science classes or other prerequisite general education courses you may need to take at the community college to keep you on track. We're there to help you and support you with that. And so we look forward to continuing to help you with your education. You all have a good day, and thank you for joining us.
Thank you.